How can narcissistic personality disorder, NPD, be induced? Narcissistic personality disorder, NPD, is a complex and multifaceted mental health condition characterized by pervasive patterns of grandiosity, a constant need for admiration, and a lack of empathy for others. This condition affects various aspects of an individual's life, including their relationships, work, and overall sense of self. Understanding the causes of NPD is crucial for developing effective interventions and support systems. The etiology of NPD is thought to be the result of a combination of factors including genetic, psychological, and environmental influences. 1. Genetic and biological factors. Research suggests that genetics play a significant role in the development of NPD. Studies involving twins indicate a higher concordance rate for NPD among monozygotic twins compared to dizygotic twins, suggesting a heritable component to the disorder. Moreover, neuroscientific research has begun to uncover differences in the brain structures and functions of individuals with NPD. For instance, abnormalities in the frontal lobe, which is responsible for empathy, judgment, and impulse control, have been observed in narcissistic individuals. These biological underpinnings point to a predisposition that, when combined with certain environmental conditions, can lead to the development of NPD. 2. Psychological factors. Psychological theories provide a deep insight into the developmental aspects that might contribute to NPD. One of the most influential theories is that of psychoanalyst Heinz Kohut, who focused on the concept of the narcissistic self. According to Kohut, NPD develops from the failure of the primary caregivers to provide suitable mirroring and idealization during the child's early development. This failure leads to a weakened self-esteem and a distorted self-image, which the individual attempts to stabilize through narcissistic behaviors. Another psychological perspective involves the defense mechanism theory, which suggests that narcissistic traits are developed as a protection against feelings of deep-seated inferiority or vulnerability. According to this view, narcissistic behaviors such as seeking excessive admiration and using others to elevate oneself are strategies to maintain self-esteem and manage these underlying negative feelings. 3. Environmental factors. Environmental influences are equally significant in the formation of NPD. These can include parenting styles, early life experiences, and cultural factors. Children who experience excessive pampering or, conversely, extreme criticism from parents may develop narcissistic traits. Excessive pampering can lead to an inflated sense of self-importance, while harsh criticism might foster a need for constant admiration as a way to counteract feelings of worthlessness. Moreover, societal and cultural contexts that emphasize individual success, competition, and personal achievement can also contribute to the development of narcissistic traits. In societies where success is heavily celebrated and failure is stigmatized, individuals may develop narcissistic behaviors to align themselves with societal standards of success and acceptability. 4. Interaction of factors. The development of NPD typically involves a complex interaction of these genetic, psychological, and environmental factors. The diathesis stress model, often used to explain the onset of many mental health disorders, is applicable here. This model suggests that while genetic predispositions may set the groundwork for NPD, it is the environmental stressors that activate these predispositions and contribute to the manifestation of the disorder. For instance, a genetically predisposed individual might not develop NPD unless they experience specific environmental triggers such as parental neglect or societal pressures. 5. Conclusion. In conclusion, NPD emerges from a confluence of factors that interact in complex ways. Genetic predispositions, psychological vulnerabilities, and environmental influences all play critical roles in the development of this personality disorder. Understanding these causes is vital for the effective treatment and management of NPD, which often involves psychotherapy aimed at restructuring the individual's self-image and interpersonal relationships. As research continues to evolve, it is hoped that more targeted and effective interventions will be developed to assist those affected by NPD in leading healthier and more fulfilling lives.